Hey there, welcome back to another Medical Minute. Before we get started, don't forget that you can request specific topics in the comments section below. Please keep in mind that we rotate between diseases/disorders, medications, diagnostics, and procedures each week, so depending on when you make a request, it may be a few weeks before we get back to that category. This week's Procedure Medical Minute is reviewing direct funduscopy. Direct funduscopy is performed during a complete eye exam, and it may also be called ophthalmoscopy or retinal examination. It allows the clinician to visualize the fundus, which includes structures such as the retina, optic disc, and surrounding blood vessels. A funduscope is required for direct funduscopy, and medicated eye drops may be used to dilate the pupils. The exam usually begins by examining the red reflex. This is the reddish-orange reflection of light from the fundus. Think of the red eye effect you see in some photos. If the light doesn't reflect properly, you'll see an asymmetrical or absent red reflex. After checking the red reflex, the physician will move the funduscope closer and will begin to examine the fundus. The optic disc is clear and the central area of the cup is pale. Overall, the retina is a normal red or orange color and the macula is dark. The arteries are bright red and the veins are slightly purple. An arterial to venous ratio of 2 to 3 is considered normal. Changes in the appearance of one or more of these structures may indicate pathology. If you want to see some examples, there's a great resource link in the video description that will allow you to compare and contrast normal and abnormal fundi and their associated pathologies. Be aware that your clinician may perform a funduscopic exam in the absence of obvious vision or eye-related complaints. Let's use headache as an example. The clinician will want to ensure that the optic discs are not swollen. This is known as papilledema, and it's a sign of increased intracranial pressure. Whether you're documenting a funduscopic exam for the first time or working with a new clinician, verify where and how your clinician wants this information documented. Some clinicians may ask that you only document the findings discussed in the room in the physical exam. Some may have you document a procedure note that also includes information regarding the equipment used, whether consent to dilate the pupils was obtained or necessary, the patient's position, and more. I hope you enjoyed this brief review of direct funduscopy. Don't forget to explore the resource in the video description for examples of pathologies that can be seen with this procedure. I'll see you all next Monday for a review of Crohn's disease. And for more updates like these, come join us online.